And we also have on the webinar, we also have joining us Cherie and Jean and Sharon and Tashiana. And we are also recording this so it can be made available to others who couldn't be on the call with us today. So I think if it's okay, I'll just turn it over to you to offer some of your insights and from the approaches that you're using with undergraduate community psychology in Zimbabwe.
All right, thank you. So generally, Zimbabwe is situated in Africa. It's a landlocked country with a population of about 15 million people. And psychology practitioners that are registered to practice, it's less than 100 for the 15 million population that we have. And traditionally, we have had one university offering psychology degrees since for a long time, I think until about 2002, when we had another university start offering psychology degree at undergraduate, and then a few others have come up. So around 2012, the community psychology was formally introduced into the academic system, and it was embraced by all the institutes that were teaching psychology at undergraduate, because they really felt it was a useful psychology that spoke to the needs of the people in Zimbabwe. So what has been done is all the universities that are teaching psychology, they now teach community psychology at undergraduate level. So it's one of the compulsory modules that students have to take for the psychology stream. They have to take community psychology because they believe that it will help them understand and be able to navigate the communities that they'll be working with from a better place of understanding them and meeting their needs, more than maybe pathologizing them. Yeah, so the aim is, this is a psychology that does not pathologize our people, but it is a psychology that seeks to understand them and help them and work with them to improve their well-being.
So one of the questions I was thinking about as you were talking was just what does the education look like for community psychology? If you're teaching community psychology, is that primarily classroom based, or are students working with community members, or engaging with particular organizations in communities, or what does a community psychology curriculum look like?
All right. So what we do is there's the theoretical aspect whereby we are grounding the students in the theory of community psychology to understand what it is, because definitely it's a bit of a change from the other psychology that they might have been learning. So it's important that we really do the grounding. Then we also offer them a chance to come up with it's a mini proposal on a social problem that they want to work on. Sometimes it can be done for the class, sometimes for the groups within a class, and sometimes maybe for the individual. It just depends on the sizes of the class and the thrust for that specific year, or it could be on a specific subject that is already in circulation. And then when that has been done, the next step is you then task them to list organizations that may be working on the same social problem that they have identified. So for instance, someone says substance abuse. So you then have to understand and know other organizations that are working on substance abuse. Then from that stage, the institute then helps you approach those organizations. And when that then happens, you then approach the organization, the institute, with the help of the institute, and we say, we've got student X and they're interested in understanding this problem better, and also offer insights from a community psychology perspective. So this is obviously with the guidance of the lecturers and the tutors in that specific module. So they then go in there, the they learn about the work that the organization is doing. And then when they come back to the class setting, they then share with us what they've been seeing, what has been happening. And then we ask them what they think can be done to improve the work that is being done by that organization. And then they'll say it out, and maybe questions are also posed for them. So at the end of the semester, they write a report on the work that was being done in that organization and their recommendations from a community psychology perspective. So their recommendations, then it's marked as part of their curriculum work, and then their recommendations are then processed further maybe by their lecturers and forwarded to the organizations that are working on that specific social problem.
Do they have an opportunity to take another course or sequence after that introductory course in community psychology?
Okay, so what they then do is we then have been encouraging them to, because this they do in their earlier year, and we have been encouraging them that when you're now doing your dissertations, which is like their research component, because you've already collected so much background information on this, it would be good that you then also focus your research on an applied research to solve problems, because that's it's also in line with what we are pushing for as you know, in the new education 5.0, which is the thrust for the university system, whereby we are saying we need the science that we are learning in the institutes to come and be practical enough to solve our problems as a country. So we are then also then encouraging them to continue with the work further in their dissertation so that it can practically, and then we are also maybe teaching them to engage more with the organizations, because we're saying you engage with organization X when you're working, and even when you're doing your research, there is no point of you working in isolation. Continue to engage with these organizations so that even if your research is put into the academic system where it could be read maybe by you and your supervisor and maybe other people, but make a difference to the lives of people by giving it to these organizations that are already working. So some organizations would be interested in the work, and some maybe they even end up getting volunteer work within those organizations, internships within those organizations, as they also prepare to go for their master's programs.
Excellent. So some students then go into master's programs, and do some then, what are some of the other career paths or things that people do with this community psychology and psychology background? Are they going into nonprofit organizations or?
Yes, some of them are going to nonprofit, maybe specialized, and they can even also do maybe monitoring and evaluation. Maybe they specialize in that. Maybe they're specialized in field work, like they help in the field work for the nonprofit organizations. They're collecting data. They're the people on the ground, you know, like doing most of the work. So they filter through, some going to government departments, some they go into the nonprofit, some continue on track into their master's programs.
Do some of them go on to counseling? You're saying there are not many psychologists in Zimbabwe. Do some of them go on into counseling and clinical work, or is it mostly going into, I guess I'm just trying to think, do they feel pulled into some sort of licensure, or do they typically not go that direction?
So, okay, so for us, the licensure is there for clinical and for counseling work. So some of them, they do go ahead and do their masters in counseling, masters in educational, masters in clinical. Then others, they actually also do a master's in community psychology, which is licensed this side.
Oh, really?
Yes.
Interesting.
So when you get a master's in community psychology, you're then licensed as a community psychologist. So what it then means is, for instance, if someone who has done community psychology at undergrad may work with you for your programming, but if you want a community psychologist who is licensed to also work on that program and put their stamp on your programs, then it has to be someone who has been licensed.
Interesting. Well, I know others probably have questions for you, but one other question I wanted to ask was about sort of as, well, I guess I had two questions. One is, I think in the United States, people have different kind of orienting. You were saying that the community psychology, they start with a kind of grounding theory before they move on to practice. And in the United States, we are often debating, like, should that grounding theory be prevention, or should it be empowerment, or where do we sort of start with the training? And I'm curious, like, if you had to kind of talk about what you think is the most important grounding concepts for community psychology in your work, what would those be? Do you know? I mean, does that resonate as a question?
Yes, it does. But I would say empowerment is maybe is much bigger for us, because if you'd understand in terms of the history of the country, the history of the different groups within the country, empowerment does become important because there's generally a disempowerment that has come, and
Absolutely,
there's been
yeah.
this notion of empowerment which does not resonate well with what we call empowerment as a discipline. So when we then speak about empowerment, I think the prevention and everything else then falls into the place once empowerment has been clearly understood and has fallen into place. So I think everything, it's easier to fall into place with empowerment in place.
Well, and I guess because of your context, we have so much to learn from you as we're trying to internationalize our curriculum and to think through decolonial lenses and to strengthen our own perspectives. The knowledge you all are producing seems so important for us. And I'm curious about how you all document some of the work from your context so that you could share it with us more broadly, because it seems so important to us.
Yes, I think we've been working on documenting it, and I'm hoping that we'll get to publish something on the, well, I think it's just generally the history and context of community psychology in Zimbabwe, and we are working on the publication, which I'm hoping should be ready soon, whereby we want to talk about the history and how this is coming into play within Zimbabwe.
Okay, one last question, and I'll open it up to others. Are there other are there ways that we might like, have you had the opportunity to engage in any forms of international exchanges with students, participating with students in the United States or other countries where they can learn from each other? Or have you all talked about any of those kinds of opportunities for students?
Certainly, it's something that that we've been working on, and we're hoping to create such contacts for two reasons for us. I think we have a pretty, I think for Zimbabwe particularly, being an African country, that's number one. But I think we have had a very unique history, not necessarily a good one, but it's been unique in its own way. And there's so much that we can harness from those experiences, and which we feel that, you know, like sometimes, you know, when we speak about, let's say for instance, the concept of resilience, and I remember even when we were attending the Scrum biennial, and someone was speaking about resilience, and the way, the lenses that I used to look at resilience is, for me, I always find it interesting when someone coping in very difficult circumstances might be considered as resilient, but in the end, it actually causes them lots of mental health issues. But because they would have passed a certain stage, they are considered fit enough. So people have said Zimbabweans are very resilient, Zimbabweans are they're non-violent. But when you look closely, we have had lots of suicides, we have had lots of maybe homicides. So those do not go in as part of our violent history towards oppression, but they do come in as something that is then manifesting to show the discontent among people and the struggles that they might be going through.
Mm. Thank you. Thanks. Do others on the call have questions for Noreen?
Hi, Noreen. I'm not sure how long this policy of training community psychologists in every program across the country has been in place, but I love the idea. And it does make a lot of sense for all of the reasons that you were talking about. I was wondering, what are you hearing from your graduates who are out and doing work? Do they feel like that community psychology framework was important and is helping?
Definitely, we do get that. And maybe of interest this semester, I had about 6 students in my class who are not from any of the psychology streams. They're from another department within the faculty. And they said, our friends from who graduated, they told us about this module, and we think it would be very interesting even for our work in population studies. So these are people that are career focused on population studies, but they still feel there's something that they can take away from community psychology that could be of use to them and their work afterwards. So definitely the students say it has helped them even look at the communities in a different lens, which does not pathologize them, but that sees their strengths. It has also helped them, you know, maybe be more tolerant, be more accommodating as they work with different and very diverse communities. So definitely we get a bit of feedback on that.
That's fascinating. And just comparing that to the US, we have such a strong clinical focus in the United States that is heavily funded in many respects and heavily supported, including by the American Psychological Association, that it's just, it, I think that your community, your country was coming from a very different perspective, and they, instead of looking at, well, what have we always done, instead looking at what do we think will work for our community, for our country, and for our cultures.
Yes, definitely, definitely. Because I think clinic has got a very long history in the country. Like I think it's the politics of the profession. But what has happened is it has remained a very elitist science or profession, if I would call it, with a certain group of people being able to access. And culturally, we've got probably it lies in our idioms of how we look at life, in our values, about sitting down to a total stranger and talking about your problems. But it makes sense for a stranger to come into our community and help us become better as a community. It makes a lot of sense for a stranger to come in and help us do certain things right. We culturally we would value the professionalism that they're bringing, but I don't feel put on the spot. There's an article that could be very interesting to read by one Dr. Mpofu. He mentions about the time he was an educational psychologist practicing in the government of Zimbabwe. They went to some rural school and they were supposed to see a boy X. So when boy X enters the assessment room, there are 3 adults, sitting in there, including his teacher. And he opens the door and gets in there and he looks at them and runs away. Because to him, it's an unacceptable behavior to walk in where adults are seated. So you can imagine how many people then filter through because they can't access that service because of the setup of the service. So community psychology does make a lot of sense for those communities.
It makes a lot of sense for our communities too. It's just getting the funding streams and political capital to recognize that. It's very hard to shift.
Yes, maybe here generally there's very little funding for anything and everything. So I guess it becomes a matter of what really makes sense more than about where is the money, because the money is not anyway. So yeah. So now it becomes about what makes sense to serve the people. What is it that I can do to bring solutions to the people? Because there is, so you'd see that even some of the clinical psychologists, they are interested even in our methodologies, because they do make sense for them reaching out to people and talking about the science. So, you know, we always call ourselves the general practitioners of psychology. There is no one who can take psychology to the people if not the community psychologist. That's maybe our mantra here, whereby we say all the other psychologists, as long as community psychology is not there to talk about the psychology to the people, you'll not see anyone coming to get help from you guys.
That's fascinating. That just makes so much sense.
Thank you.
And you work, Noreen, you also do some work with the Zimbabwe Psychology Association, right?
Yes.
So how does that organization function to support, does that support your work in certain ways?
Yes, so the Zimbabwe Psychological Association will be our local APA. Yes. So what we have done is they have promoted all divisions of psychology, the clinical, the educational, and there's the general consensus. Oh, and just recently, I think 2 weeks ago, I was elected to be the president of the association.
Oh my goodness,
So,
congratulations.
yeah, so certainly what they have done is, I think everyone, including the clinical, the occupational, the educational psychologists, they have realized the importance of the science called community psychology in promoting well-being, psychological well-being, among other things, in our communities. So there's a general embracing of the science, and we also do like capacity building workshop with our colleagues from the various other fraternities.
Is there are there associations with others in your region beyond Zimbabwe?
Yes, we have them. There's the Zambian association. There's also the South African. There's also I think the Namibian one. So, and then there's the general, the PAP, which is the Pan-African Psychology Union. Yeah. So we've got a couple of others as well. But maybe interestingly, I know South Africa is offering a whole, they've done a whole lot of work around community psychology, but they're not licensing it. They don't have a master's program dedicated to community psychology, but they're promoting a lot of community psychology even in the undergraduate modules as well.
So as the field is developing in Zimbabwe and maybe more in the Pan-African region as a whole, are there particular practices or theories that are kind of emerging as kind of being sort of the Zimbabwe view of community psych, or sort of particular specific ways that Zimbabwe is sort of adding to community psych or contributing to it?
You know, interestingly, I was having a conversation with a colleague around this the other day, and we're saying, what theories are we seeing coming out? And maybe one of the most important ones is, like, maybe we have been speaking about before, is there's when psychology goes into communities from a perspective of strengthening them, it becomes easy even for them to be vulnerable to it. That's what we have generally been noticing. When it doesn't seek to pathologize them, it allows them to be vulnerable to psychology. It allows psychology to even then diagnose them. It then allows them to do that, because once you've gone in there, then they're willing to come up and say, but I think I'm having a challenge with this, which is traditionally not possible. But the moment we go in and we emphasize that which they're doing right, they are willing to be vulnerable to psychology. That's one of the things that we have been noticing a lot as we work with communities.
Wow, that's really fascinating. Thank you.
Thank you, Sharon.
So I was thinking, so that theory is the, as you're doing that kind of work, like seeing those relationships, for example, between a strengths-based perspective and vulnerability, is there, are there researchers who are working with the practitioners, or do people take on the identity of being both a practitioner and a researcher, or do people kind of take on both of those identities, or are they kind of separated? Some are practitioners and some are evaluators or researchers, or or does that a mix of?
I think it's a mix. Some purely practitioners, some are practitioners, researchers, and some are just researchers. So I'm an example of a practitioner researcher anyways. Yeah. I'm a bit in both, but I know some who have just stayed in the community psychology frame, and others that have also just stayed in the research field. Yeah.
Interesting. Well, this is so it's so interesting, and I wonder if there would be. We were just talking before you came on about the possibility of sometimes having a kind of way of developing a resource or kind of clearinghouse, or some way of sharing expertise with one another with our students. So kind of Sharon had the idea of a kind of virtual guest lecturer kind of idea.
Certainly.
And I wonder if that, I was just trying to think about ways that we could continue this conversation. And I wonder if that would ever be a possibility to talk with one another with our students also.
Yes, definitely. It would be an interesting opportunity as well. You know, one of the things that I'm always keen about is to, for instance, let's say maybe there are students in the USA that are interested in substance abuse, and there are students here that are interested in substance abuse. It would be interesting for them to even compare notes amongst themselves of their different contexts. You know, I feel it could be a very enlightening experience just to get to know the other context, because maybe generally, because I'm here in Zimbabwe, and I would say probably substance abuse is a problem here because we are a poor nation. But maybe when you hear someone talk about substance abuse being a problem in an affluent country, it gives you a whole new perspective of the problem, and it allows you to really interrogate further the problem. So definitely it would be an interesting space to share such information.
Absolutely. I love that idea of students comparing notes on, because that's sort of where you started talking about that part of the one of the important components of the class is that students are identifying particular social problems and then investigating those. And so substance abuse is one that comes up. Are there others that come up really frequently for the students that they're interested in?
Yes, there's the issue of child marriages. It's certainly something of interest, the child marriages. So so what we have also done is, of late, we have been asking them to maybe look at specific sustainable development goals and interrogate the social problem vis-a-vis the sustainable development goal, and say, how does this affect us as a nation? And was this sustainable goal speaking into our nation? Was it speaking into our country? Is it something that we need to also look at as a country, and then we can also look at it from that perspective? So you'd see that we get a lot on early child marriages, we get a lot on substance abuse, also a big issue there, and I think those are the four we talk about in
I'm sorry, the very last minute, we had some, I couldn't hear very well. It kind of, there was some interference.
So the last one was corruption.
Oh, okay. Okay.
Because generally, every time we hear about how corruption has affected us as a country and all those things, but the question is, how are we understanding and looking at corruption from our perspective? What could it be? And we are trying to redefine and understand from the perspective of the people.
Yes. Yes. Well, we are at the end of the hour, and I know that folks have to go at the end of the hour. So, are there any other questions or thoughts that others have?
I like that idea of bringing the students in and exchanging what it looks like where they are in regards to the social issues. And I was thinking about the international part where we're doing, we at our institute, we call it the Study Abroad program. We have a couple of programs that have taken place with different countries, but I think that would be a great segue for community psychology and what it looks like. We haven't did anything on community psychology and with a study abroad program or even an exchange or where students are in the classroom engaging and talking about social issues. So I'm very interested in that as well. I think that will be very eye-opening for the students.
Oh, thank you.
Mm-hmm.
Yeah, I agree. I agree. That would be amazing. Well, Noreen, I'm just so grateful that you were willing to join us. I know it's late there. It's 9 o'clock in your time, and we really appreciate your joining us and sharing this. It's really, I am also excited about thinking about possibilities for our students to continue to learn from one another and to think about ways to continue this conversation. And so, thank you so much.
Yeah. Thank you so much. Thank you.
Thank you, Sharon.
Thank you.
Good night. Good night.
Good night. Good night. Sleep well.